All right, let's roll. We're going to bring some health home. So tonight I'm talking to Amy Feranec, who is a physician assistant. Now it's called physician associate for 20 years. She's also a breast cancer survivor. Amy and I have been working together for those 20 years. So there's a lot of topics we can cover, but we're going to try to stay in our lane and talk about cancer, wellness, orthopedics. So hello.
Hi, I don't know you if you can stay in your lane, but we're going to really work on it tonight to
Okay.
stick to topic.
So I'm gonna start this off where I was thinking about, since you're a breast cancer survivor, before getting into that, I kind of want to know what your thoughts were about cancer when you were growing up. So when I was growing up, I was kind of like right in the center of the big anti-smoking campaign. So if
Hmm.
somebody got cancer, you pretty much were like, well, did they smoke? And if they smoked, you were like, okay, it was related to smoking. If they didn't smoke, then you tended to think it was just bad luck. What were your thoughts? Was that a similar thought pattern?
I mean, I think growing up, both of my grandfathers died from cancer. One was related to asbestosis, and the other one was related to cigarette smoke. So for me, I just kind of thought of cancer as something of that affected just older people. And of course, you'd see the kids with leukemia, but I never really thought about that mid range between, college to middle age, 50s, 60s of getting cancer. I always kind of thought it was more at the ends of the spectrum. So that was what I initially thought for me. And of course, you always see the people that have breast cancer, but again, it wasn't something on my radar.
Did you have any thoughts like when you're growing up about trying to eat healthy or trying to exercise as potential to prevent cancer when you got old, or wasn't even on your radar?
It really wasn't on my radar. I mean, overall, I look back to I mean, I'm a child of the 80s. And I think you're kind of similar in that we were the time of a lot of processed foods that we thought were healthy and they were quick and convenient. But we all ate them. So I think that we weren't even thinking, could these artificial ingredients cause problems down the line, like we are nowadays?
So when you got diagnosed with cancer, like I kind of considered you a pretty healthy person. You seem to we share an office, so I see what you eat, and you eat pretty healthy. You were exercising a lot. I think you were doing triathlons and all those kind of things. So you were kind of like a black swan event in my life, in my mind. So kind of like somebody who's not expected to get cancer. But you also had a ruptured disc in your neck when you were really young, and that was also
Mm-hmm.
another black swan event. When that first one happened, were you at all like, how did this happen to me?
Well, I've always been a very active person, and I recall the incident actually when it happened. So I used to do hip hop dance, and I remembered doing a performance, and afterwards I was like, this is not right. And then I started having the ridiculous symptoms with the pain going down my arm. I was convinced it wasn't what it was. And so when I actually saw my MRI, I was a little shocked that it was as bad as it was, given that I was only 24. Um, Especially because all my other levels were so healthy. Um, so yeah, I definitely was shocked. And like you said, I was very active after all my pregnancies. I did triathlons. I was always working out, getting up at 4 in the morning, going to the gym. And I feel because of being in medicine and orthopedics, I was a little ahead of the curve in with regards to eating healthy the right way, not the fat-free diet or the fad diets, but really trying to eliminate processed foods and was doing a whole 30 before whole 30 was actually a thing. So
So,
I
and
was
just
shocked. Yeah.
just to clarify, because when people rupture their disc in their neck and they're 24, usually they're like, oh, go to therapy, you'll be fine.
Mm-hmm.
In 25 years of orthopedics, it is the biggest ruptured disc I've ever seen. Like it was huge. So there was nothing to
When I
do
do
with
things, I
that.
do things right. So,
Yeah, it's nothing to do. And it was hair dancing, right? Which, whatever that is.
No, that wasn't hair dancing. That was actually hip hop dancing. I didn't do it. I still can't really hair dance as well as I used to because of the plate and screws, but
Okay.
we all can't be
So,
great at everything. So,
so then you fast forward, you're an adult, you have three kids. What's the
hmm.
story behind your diagnosis of breast cancer? Like, how shocking was that? Because you were super young for your typical case, it seemed like.
Oh, for sure. So even when I found the lump, which I found on my own, I remember then having a swollen lymph node. And actually another PA was up at the practice at that time. I said, well, you can feel this lymph node because it feels really swollen. And I even said to you, I'm like, yeah, I think I'm going to go get this checked. And you're like, I should just go sooner than later. And even my primary doctor kind of blew it off as it's nothing. I wouldn't even worry about it. And I kind of pushed to make sure I got the ultrasound and the mammogram. And then once they did those, I work with the radiologist all the time as we do with our office. And they said, we need to get an MRI. And we kind of found out right away that it already spread to the lymph nodes, which to me was shocking because again, I ate pretty healthy for most of my life. I worked out, I breastfed all my children. I had children, at a younger age. So all of those factors are things that decrease your risk for breast cancer. And no one in my family has any history of breast cancer. And again, those two cases of cancer I talked about were related to environmental factors, cigarette smoking and asbestosis. So it was shocking to me. And it kind of rocked everyone's world and around me because all my friends were shocked. They're like, well, if Amy can get cancer and she's this healthy, we're all doomed. So it was definitely, I was life changing for sure.
So now, like at the time, was it very much of a why me at all, or did you just think it was a random event that could happen to anybody?
I definitely thought it was random. And I've always been the kind of person that I feel if I have something negative, I need to try to make an effort to make it a point to make it me learn something from it or someone else learn something from that negative thing. I don't want to dwell on it. And it has. I mean, I always say I was glad that it was me that got the cancer and not my family members because you feel helpless when it's someone, you can't do anything. But for me, I knew I could be strong and push through and deal with the pain and all the treatments that I had to deal with and show everyone around me that you can be strong even if you're going through something really terrible. I mean, I came to work. I mean, I came to work every day when I was going through chemo, except the days I had chemo.
Was your
So
boss mean, or like how come your boss
he
didn't?
was terrible. He was so terrible. He was terrible. He made fun of my bald head. No, he didn't make fun of it, but patients did make fun of my bald head. That was
Uh-huh.
pretty fun. So, but,
But you enjoy your job so much that it was stress relief to go.
actually, my boss's wife paid me extra to come into work because she knew that her husband would be lost without his PA in the office.
Okay. Okay.
So,
So now you're in your treatment. Did you see any role of eating healthy? And your treatment went longer than just your standard surgery, couple months of chemo. Like it went for a while. Did you see any role of kind of wellness, nutrition, fitness, stress reduction during your pretty long recovery?
absolutely. I mean, what I ate, I definitely kept my body strong. The fact that I was thin kind of complicated some of my post-surgical or like revision surgeries because I needed more fat to do some of the flaps. But I really went through chemo pretty well. And like I said, I worked every day except for the days I went to chemo. And I think that's because I ate really well. My body is prepared for it. Now, after cancer, for that next 2 years, I was very strict in what I ate. And maybe we'll talk a little bit about this later, but some of it goes into the myths associated with breast cancer. You can't have soy, stay away from dairy. And so there are all these things that you hear tidbits of. And when you're going through it and you're in that panic mode, you're trying to pull whatever you can to control your treatment because you can't always control what the cancer is going to do, no matter what medicines you take or treatments you receive. So for me, I was grabbing at anything that I could hear and trying to incorporate it into my diet. So I was eating pretty strict. I had lost more weight, which again led to a longer recovery with surgeries because I needed more fat. But to answer your question, yes, I think that my nutrition helped me to do as well because the doctors were really not optimistic. Their prognosis for me was not great. So yeah, it was tough, but I think that being healthy helped it.
And then any role of fitness and stress reduction or any stress reduction techniques you came up with when you were dealing with that prognosis?
So I did walk a lot. when I was recovering. I think that was huge. I think
Way
sometimes
before the
people
walking challenge.
I was walking before it was cool to walk. I actually think I
Okay.
gave you the idea for the walking challenge, but we'll
Okay.
go somewhere else with that. Um, yes, definitely walking. And my faith was really strong. And so I was praying and saying the rosary and saying novenas every day. And during those times, I would be doing some yoga stretching. So in my own way, I was meditating and relaxing my body during this super stressful time. Everything else was going in chaos in my body with the chemo and then surgeries and the radiation, but I was trying to keep myself centered, not only for me and my recovery, but also for my family, because I didn't feel like I couldn't break down. I still had to be a mom. I still had to be a wife. I still was working. So it was a lot of things that I felt I had to do. And I could only do that by putting my health as a number one priority by working out and eating as healthy as I could.
So when I was a senior in high school, my uncle died of brain cancer, and um, at a very young age, I remember overhearing my parents being worried about his diet. So when he died of brain cancer, uh, nobody ever correlated it with his diet. And I don't know if even now you could correlate it with his diet. But I also
Mm-hmm.
remember my parents being worried about his blood pressure. And it's funny because the thing they were worried about was that he would eat his steak well done. Like that was the thing they were worried about. But for some reason, I
It is pretty disgusting.
associated at a
So
pretty young age that if you ate bad, you were raising your risk of cancer. So like I always wanted to eat healthy. I did the best I could, but I was definitely eating fast food, all that kind of stuff when I was young. But there was that low level stress of like, you better quit eating this by the time you're 25 or you could get cancer. And 25 became 40 or 35 or whatever it was. But did you ever have that thought, like if you didn't eat well, you were going to give yourself cancer? Or was like there any stress around your eating before you got cancer and after you got cancer?
definitely not before, because like I said, I was completely shocked when it happened. Um, and as a note, I was genetically tested and there was no, you know, reason why I should have had the breast cancer except for something environmental. So for me, it was even more important to eat healthy afterwards. And again, I always try to eat healthy, but it was more of a motivation of just feeling good and looking good, like staying at a healthy weight, especially after having the kids. But afterwards, it was more a matter of focusing on how my body reacted to it, doing some research, trying to figure out what foods and the technique and what I ate, whether I was going to do fasting or eating smaller portions or larger meals, trying to figure out what worked best for me to make me feel the best that I could.
So when you and I first started working together, you were already eating really healthy.
Uh
Uh,
huh.
I was eating
And I was
healthy at
also
home, and
doing like
then
35 push-ups in a row, which you still don't believe me about, but that's
yeah,
okay. So go ahead. Uh
I was eating very healthy everywhere but at work, where I would eat like
huh.
a
Uh huh.
full pizza or whatever.
Right.
But that was when
Mhm.
how old was I? I was probably 35, 37, something like that. Like, so
Well, so 19 years ago, you would
yeah,
eat a full pizza and then a huge bag of plain M&Ms for your
yeah.
lunch.
Yeah. And I was sugar addicted because on weekends at like 2 o'clock in the afternoon, I'd be like, oh my gosh, like, why am I searching for sugar? But I
Hmm.
have since totally remodeled my diet. But there's other toxins in the world besides
Hmm.
diet that can contribute to cancer. Um, when did you start becoming aware of that?
So when I was diagnosed, it was interesting to me because I lived on a street of 32 houses, 33 houses. And of those 33 houses, including myself, there were 8 breast cancer patients. So, they say 1 in 8 is the statistic, but we still had more than that in that area, which was kind of interesting, given that we were all kind of varying levels of age, activity, but we all kind of had a similar diagnosis. We all were ER positive and HER2 negative. So then you think, okay, when I became more involved in the cancer community locally, particularly in Anne Arundel County, there's very high incidence of breast cancer. And you wonder if it has something to do with some of the toxins coming in, funneling because of the Chesapeake Bay. Not the water itself, but just the flow of air. So there are a lot of things that I think need to be
Is it more the
investigated.
Bay or the industries around the Bay?
I think the industries around the Bay.
Okay.
Um, and there was a lot of talk about they used to spray a ton for mosquitoes back in the day around the water because, and that those chemicals were carcinogenic. So again, I don't know for sure. And I really haven't delved in those depths because I feel as though I already got the cancer. I can't change what caused it. I just got to change what it's going to do in the future. So I need to try to protect myself and my kids as much as possible. So.
So as you're trying to protect your kids, yourself, your husband, nieces, nephews, everybody, like what are your thoughts on the balance of nutrition? Like you don't want to be insane and give them an eating disorder or a fear of cancer, but like how do
Mhm.
you manage that?
Well, I try to set a good an example for them by eating really healthy. And that doesn't mean that I don't fall off the bandwagon and have a snack here or there because I want them to see that it's okay. You don't have to be tied to this, but you have to make good choices most of the time. And that's how we are in life, right? We need to make good choices the majority of the time. Every once in a while, we make a poor choice or a choice that's not the best choice for us, but it may not be a bad choice. So I want the kids to see, when we have dinner at night, I eat my dinner on a bed of kale or arugula every night. So they see that I'm constantly eating greens. They're like, why do you always eat salads? I'm like, well, I want to be healthy and take care of myself. And so now my youngest Landon just likes to eat lettuce, just plain. And he said, I just want to be healthy. So he does that and wants to dip it in ketchup. But it's beside the point. It's
He
it's a
he dips
work in
lettuce in
progress.
ketchup.
Landon eats everything with ketchup. If he
Okay.
could, it's just we're trying to break the habit. But
So I had
he,
one that dipped everything in ketchup and another one who dipped everything in Old Bay. And
oh,
we
the
were worried
salty
about the
and sweet.
salt content of the Old Bay, and now that people are less worried about salt, more worried about sugar, she's kind of angry. She's kind of
Yeah,
angry that we didn't let her have Old Bay all the time. It's like
just a little bitter.
we didn't totally shut her off of Old Bay. We're just like you don't have to have it on everything. Um,
But it is in Maryland. It can be on everything. I mean, they have it on popcorn and chips and everything else. So,
yeah. So what are your thoughts about like so if you were trying to create a cancer-free environment, you're
mm,
eating the perfect healthy diet, you're living away from industry, you're out like in the woods of Montana or something, uh, you're not putting any products on your skin or using deodorant, whatever it could be that's linked to cancer. Do you think do you think that kind of thing makes a difference?
yes, in some regards. I also think it depends on how quickly it progresses, possibly. But I think sometimes our cells they become cancerous, and sometimes there's nothing that you can do to prevent it. But what you can do is maybe, and I say that there are some cancers that you can prevent by doing certain things like not smoking cigarettes, but people that don't smoke cigarettes still get different types of lung cancer. So um, these things still happen. And I think we notice the frequency of it more now because there's much higher testing for it too. I mean, you look back in the 1900s, 1800s, you weren't diagnosing cancer. People were just dying and they weren't necessarily investigating all these things. So, um, I think it still would happen, but I think that the chances of a prolonged recovery, tolerating treatment would be much better being conscious of what you're eating and also just exercising and keep yourself moving.
So I've always been a little bit confused. I always wonder why the environmental movement, kind of like the climate change movement or the environmental movement doesn't have more of a focus on the internal environment also, kind of like they go together, like clean
Mm-hmm.
air, clean water, but also putting clean food in your body. It just seems like a natural thing to do. So when we talked about, nutrition, but are there any environmental things where you're like, I don't want that in my house or staying away from different things or want your kids to stay away from different things besides cigarettes
Well, I mean,
or
there's a lot of
tobacco?
talk now. Yeah, a lot of things. There's a lot of talk about microplastics, right?
Mhm.
There's talk about that in everything. And you try to get your kids to drink more water, but they're in these plastic bottles. And so you're buying these stainless steel bottles, which my kid lose all the time. So I probably buy one every week. But plastic is everywhere. And so, yes, there's not a direct correlation, but these are small things that we're getting these in our body just through healthy foods. I mean, you can go to Whole Foods and your food's still packaged in something made out of plastic. So there are risks with everything, and it's just trying to minimize that as much as possible. But it's difficult. I mean, I think the society we live in today, it's hard to be away from all those things. Like you said, unless you go live off on your own and you're only eating from the land, but even that, you're going to have some type of environmental influence.
Yeah. I mean, it's like being a black swan. You can do everything right.
Mm-hmm.
You can not smoke. You can not drink or drink in moderation. You could eat a totally clean diet. You can try to avoid, plastics and on all those things, and you can still get cancer. And
Mm-hmm.
even more so because at your age or my age, it could have been something we did a long time ago when we didn't even know.
Correct. And that's the thing is you can protect your kids so much and try to give them the right information. But like you said, they're going to make their own choices. If they want to put Old Bay on everything, yeah, you can tell them no at home, but who's to
We're
say
not
when they put it
implying that
right
Old
now?
Bay causes
No, no,
cancer.
no, no, no.
I'm pretty
I'm
sure
just
Old Bay
saying for
prevents
choices.
cancer.
Yeah, I love Old Bay.
Yeah.
We should get them to do this podcast. We love Old Bay.
Yeah.
But what I'm saying is, it's just from choices in general in life that even if you tell your kids, hey, you probably shouldn't eat that because it's not that healthy for you, you're not going to be with them 24 hours a day to where they might still not use it occasionally. And so that's the same thing with unhealthy foods, eating something that's highly processed. You're not going to be with your kids every day to say, no, you can't have that. They're going to go to their friend's house, but you just try to limit it as much as you can at home and set a good example and hopefully adjust their taste buds so that they enjoy the healthy foods and not as much the unhealthy stuff.
Are there any things that like sticking out in your mind that maybe when you were a teenager before you had cancer that you ate because you thought it was healthy and just because of times
Oh my
change,
gosh.
knowledge has changed that now
So
you
many things.
like what are your
So many things.
top ones?
So I remember thinking I was always eating super healthy compared to my classmates because I would bring in like those lean cuisine microwave meals. So looking back, all that plastic and there's so much salt. I would eat a lean cuisine meal, butterscotch crimpets, those tasty cakes. They were
Oh
so
yeah.
good.
Yeah, I had
I used
those
to
at
eat them.
Ho-Ho's almost every day of school.
I was never a big fan of ho-hos, but the butterscotch crimpets, I would eat them at like every day. Um, and stuff like that I thought was good. Or like I'd have a snack and be like, I'm just going to have cheese and crackers. Why eat that like, the cheese whiz and crackers, which is not even really cheese. I know you like to have cheese whiz too when you were a kid. Um,
My
I'm
wife
trying to think
can't
what
believe
else.
I was allowed Cheese Whiz. My mom will probably listen to this. Cheese Whiz was delicious and we didn't know. I mean, we were eating margarine back then. We didn't know.
Yeah. Yeah. I can't believe it's not butter.
Yeah.
Everybody thought margarine was better than butter because there was the whole low fat movement where fat was bad. So everything that you thought was healthy was low fat, but it wasn't good. It was just filled with more sugar.
So now are you more like a Whole 30 type of like lean meats, vegetables, fruits type of thing?
For sure. I went a phase of doing completely vegan. I mean, I've done it all. What haven't I tried diet wise? I've done intermittent fasting. I've done vegan. I've done vegetarian. Um, I've done more, and right now I kind of just live more of a plant-based diet. So the majority of what I eat is I try to do plant-based foods, but I do supplement with meat. I don't really eat pork, but I try to have meat and I eat eggs. I eat a lot of eggs. And I do eat dairy. I do cottage cheese. I do oat milk, but that's not really dairy either. But I definitely am finding what makes me happy too in life. Cause I think sometimes when I was vegan, I love a good steak and vegan was fine for me, but it was difficult because there were things I couldn't eat and it limited what I could enjoy. And when you went places, a lot of times they used butter or dairy, to cook even the vegetables in. So it made it difficult to eat things outside of the house, and feel social. And so the social aspect of it made me feel like I needed to slowly incorporate some of the stuff back in, but in a healthy way.
So you're eating with your husband, your three boys, teenagers
Mm-hmm.
and a preteen. You don't
Yeah.
want them to starve. How do you do like dinners and meals? Like, are you eating the same thing they're eating, or are you like adding something to them so they get enough calories? They're playing sports, all that kind of stuff.
Oh, they eat so much food. I'm going to have to ask for a raise from my boss to pay for all the groceries because it is crazy. Um, so for example, for tonight for dinner, we did breakfast for dinner. So I made steak and eggs, and then I had bacon for the kids too, and they had like whole wheat, like thin bagels, and we did. I had cottage cheese. So for me, I just had a little bit of steak, mostly eggs and cottage cheese, and then the kids supplemented by adding the bagels and the bacon in addition to that. But I made 18 eggs and they're all gone. So,
And Landon had salad with ketchup.
no, well, Landon had eggs and
Okay.
bacon and one half of the waffle, but he did have ketchup. He goes, ketchup on eggs is just so delicious. I'm like,
Oh
well,
man.
it is what it
So
is. You can't win all the battles, so it's fine.
we eat a ton of eggs also. Literally Roddy, who's my 20, he was 20 when he did this, but he went a whole semester where all he ate was eggs and ground beef. Like it was just, he's in college and you're like, okay, well, you need a couple extra stuff, but like people would criticize, not people, but I would assume if I told anybody that, now everybody knows, people would be like, well, where are his vegetables? Where's his fruit? Well, that's not what college students are eating. They're substituting
No.
French fries and potato chips and cake and cookies. So it's good that he eliminated all that stuff.
Yeah, I mean, if he's just eating eggs and meat, he's kind of doing a modified carnivore diet.
Yeah.
So,
He kind of got sick of it though, I think. So moving on, tell me about the Amy Strong Foundation and how that fit into all this.
when I was sick, the boys were 1, 3, and 5, and my brother had started a GoFundMe to help us, just because we had to go from having a part-time nanny to a full-time nanny, and I think they raised like $10,000 or something. And at the end of the day, we felt as though after going through treatment and meeting so many people, we realized there were so many other people that needed more than what we needed it for. That if we could make a little sacrifice, maybe we could help someone else. And I remember specifically walking one day and I said to my husband, thank goodness that this happened now when the kids are young. One, they may not remember it as much. And two, from a financial standpoint, it's not going to impact them as much, because maybe if they were going to colleges, we'd have to say, hey, you can't go to this college because we can't afford it right now. So we ended up deciding to start a scholarship using the money, and that's how Amy Strong started. My brothers all made shirts, and it kind of stuck as like a fundraiser thing, and so that's where the name came from. And then from there, we've done the scholarships, which we've given out over $150,000 in scholarships, and we've done boxes of sunshine, and we've delivered, 500 boxes of sunshine care packages, and we also sponsored Cancer to 5K. So from something that was so negative, we were able to create something that impacted so many people in a positive way. Because it still happens, and breast cancer happens to so many people. And one of my really good friends lost her mom, and actually she just lost her dad to cancer also. And the scholarship is named after her mom. So I want to be able to spread some light to this terrible disease, and not to make light of it, but to let you know that it happens and there's still life after it. And there's so many people in your community supporting you like they supported me.
So do you have a lot of people reach out to you just because they know you went through it? I mean, you were so young that uh, people definitely noticed. So do people still reach out to you about like when they feel a lump or they first get diagnosed, kind of a what should I expect?
Oh, for sure. I still get a lot of people. I get a lot of texts of, can I give your number? And I always say yes. And a lot of those people don't. And when I was going through it, I had people give me numbers. And it's just sometimes you don't know what to ask. You don't know what to say. Cause you're so overwhelmed. But yeah, I have a lot of people that come to me and ask me, what should I do? A lot of it is friends and family members saying, what helped you get through it? What can I do for my friend? Because I feel helpless. Like, what made your treatment or you going through all the cancer stuff, how did it make it easier? And so they ask me that a lot. Um, so yeah, I think I still get asked a lot by patients, partly because I also have the medical background. So I have a little bit more knowledge from that standpoint. But yes, from going through it, how I dealt with it with the kids and managing work, and just life.
Do you see many people like that you meet through the foundation or just calling you that take fitness and wellness and nutrition and all those things as seriously as you do? Or do you think it's more people who were into it before stay into it? Do you ever see it as a huge wake up call for people or not really?
So I say there are some that really make a significant change. There's others that make a temporary significant change and then revert back. And there's some other ones that feel like, well, I've already got cancer. I ain't changing anything. I only live once. If it comes back, it comes back, but I'm going to eat whatever I want to eat. And to be honest with you, I have people that ate super, super healthy and their cancer came back. I have people that have kind of gone back and forth and their cancer came back. And I've had people that ate terribly and their cancer came back. And again, same thing through with not having their cancer come back. So it really depends on your pathology, how aggressive it is, what treatments you had. Um, I just think you need to make yourself feel good. I mean, when I eat food, I'm doing it because I need to eat something that makes me feel good. There's a lot of things that I don't feel good eating, and I don't want to live my life eating something that I think tastes good, but I suffer later because life is short. You want to make yourself feel as best as you can and be as high functioning as possible. And food is the key to that.
So that's one of my thoughts about nutrition is that and we'll get into orthopedics. This will be our lead to get into orthopedics, but
Mm-hmm.
a lot of people who are coming to see the orthopedic surgeon are having problems with chronic inflammation, and a lot of those are due to nutrition or lack of fitness, horrible stress, not being able to sleep. All that stuff leads to chronic inflammation. And chronic inflammation, those same things can lead to cancer. So although
Mm-hmm.
you can't ever eliminate all those, you can make improvements. So the issue is in orthopedics, do you ever see people where you're like, this person is a ticking time bomb, for
Every
cancer,
day.
for heart disease, for whatever?
Every day. And I mean, you can attest to this too. I mean, you know the answer. Yes, we see this every day. This is a conversation we have in the office every day. Our poor scribes are probably bored with it because that's all we talk about
Yeah.
is trying to tell patients, you need to lose weight. It'll help your joint. You have all these aches all over your body. Maybe it's because of the food you're eating. And people always look at us sideways and you ask them, well, what are you eating? I eat healthy. Okay. Well, what is healthy to you? And they're like, well, I only drink Diet Coke and I use whole wheat for my sandwiches and I have a lunch meat sandwich with cheese and mayonnaise and I do the light potato chips. And you're like, okay, stop right there. That's not healthy. You're choosing options that may be healthier versions of something really bad, but that's not what you need to be doing. Or you'll have someone who is morbidly obese and they say, I don't need anything. What do you mean you don't eat anything? I have a glass of water, a cup of coffee, and a piece of toast every day. That's all I eat every day. And there's no way. So I think it's a battle to convince patients to really focus on their nutrition because they come to see us saying, fix my knee, it hurts. And then we're going to try and lecture them about eating healthy to help your inflammation. And they just hear, wah, 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 I just want a cortisone shot in my knee. I mean, do you agree with that? I mean,
Oh yeah. Well, there's a couple things. The first thing is about you come to an orthopedic surgeon, you don't really want to lecture about your whole lifestyle. Like there's a
mm-hmm,
balance between honesty and cruelty.
mm-hmm,
And if you fall down and break your wrist, you don't want me really questioning you about why you're not doing agility training. And if you're having a bunch of problems because of chronic inflammation, you gotta pick your battles. You gotta kind of be careful about it. But I also think there's the issue of like what you said when you were younger. You thought cancer was a long way off. So I think when
mm-hmm,
you're young, I mentioned that in my mind, I was worried that nutrition was linked to cancer, but still, I thought I'd be old. So it's pretty hard to make that choice on a daily, meal plan to say, okay, well, I'm worried I'm going to get cancer when I'm 70, so I better not stop and get the McDonald's French fries today. It's just too far off. And I think that's the same thing with weight or trying to look good is that you
mm-hmm,
don't look good if you just eat healthy for one day. You don't get the weight off if you get healthy for one day. You don't prevent
mm-hmm,
cancer by eating healthy for one day. So
right.
it's all way too far off in the future. So I think the only way to get people to eat healthy is to basically eat what makes you feel good and gives you energy that day. Because the other
Right.
stuff is you're going to lose weight to go to the beach and then you're going to gain it back. And that cycle eventually you're going to give up on.
Well, I also think from a factor of our patients, we have patients from varying socioeconomic status that can't afford to eat some of the healthier foods. I mean, they look for something that's inexpensive, and lots of times that's the highly processed foods or something quick for them to eat because they're working two jobs. And so when we're talking about, oh, well, maybe you should try to eat this, it's not relatable to them because it's difficult for them to say, okay, well, I'm going to make a salad, but I have to go from one job to another job, and it's just not going to keep. I don't have that. I need to just pack something easy and simple. And so it's trying to find a way for everyone to be healthy, but also as a nation, because America's deal, and I don't want to get anything political, but with all the processed foods and allowing certain additives that aren't allowed anywhere else in the world, having those freely accessible and inexpensive for most people is terrible. Like, they don't have any other choice but to eat some of that stuff. So I think, again, on a tangent of that stuff, I think trying to get them to eat as healthy and meeting them where they are and helping them understand that they can still make good choices without having a dietitian and a trainer and, somebody watching their weight for them. They can try to just make better choices that make them feel better.
It is interesting because the wellness community very much is kind of like, just eat these things. Oh, you don't have time, meal prep. It's too expensive. Well, it's going to save you money in the long run. It doesn't necessarily deal with the today and now of the whole thing. Mm-hmm. And there's a lot about how people in conventional medicine like us, we didn't get much training in school about nutrition, exercise. It's not that complicated. Like, literally, I could give a nutrition lecture in just saying, eat vegetables, eat fruits, drink water, eat lean, grass-fed meat, wild caught fish. That's enough. Like, that's your lecture right there. And for fitness, move your body, walk every day, whatever it is, do a couple push-ups, do some stretches. It's not super complicated. The complicated part is getting people to do it. And
it's implementing it into their daily life. Right.
Yeah. And as in orthopedics, we see the super fit 50, 60, 70-year-olds who are, coming in because of a rotator cuff problem because they're 80 and they're still playing tennis. But we also see the 50-year-olds, 60-year-olds, 70-year-olds who are pretty much disabled because of their poor bone health, which is related to fitness and nutrition. Mm-hmm. And there's other factors too.
Right. And I think, we can talk to, and there's been so many times that you've had this happen to you and I've had it happen to me, where you come out of the room and you're like, I think I just made someone change. They're going to change. They're going to do a new diet. They're going to take care of themselves. I'm so excited. And then we see them 6 months later and nothing's changed.
But we do have people who like, I can think of two people specifically where they told me, oh, I lost 100 pounds or I lost 50 pounds. I'm like, well, how did you do that? And they're literally like, my doctor told me to, and I do what my doctor tells me to do. And I'm like, okay, well, how'd you do it? And they basically just said they just drink water, eat vegetables and meat, and, not as much processed carbs as they used to. And they walk, and it just came off for them. There are people who do it. Like, you see it all the time.
Yeah. I mean, we do see it, but there's also, like I said, there are always these ones where you feel so motivated. I think the one thing I tell all my patients, and I don't know if that I tell the patients when I'm talking about weight loss, is I tell them the first thing that they can do that's really easy, that's not going to change much of anything, is to cut out their calories that they drink. So cut out sodas, try to cut out sugar in their coffee, cut out the sweet tea, cut out the juices, and just drink water. And then you can still eat whatever you're eating, but to try to cut that just to flush it out kind of cuts out those calories. Because so many of them say, oh, I only drink 2 or 3 sodas a day, but there's so much sugar. And so I try to tell them to start in baby steps. And whether that works, I don't know. But it can be overwhelming to say, I'm going to overhaul my whole diet. And then you get home and your husband or wife says, well, I'm not doing that. I'm going to eat what I want to eat. And then it's hard to say, well, I'm only going to have a salad for dinner while you're having something that I really want to eat.
So we also see people who have some real serious problems that actually cause a ton of pain. Nothing to do with wellness or anything, like huge ruptured discs in their neck like you had, or in their back, or multiple joints that need to be replaced, or fractures that happened the day before that are bad, broken bones, broken wrists, broken, ankles, all those kind of things. But we also see some people with much more minor problems.
Hmm.
Do you ever have problems when those people are kind of really how do we say this? Exaggerating their pain level when you had a serious life-threatening injury to their 30s? Do you ever, in your early 30s, or were you, yeah, early 30s, do you ever have that moment where you're like, this is not life-threatening, settle down?
I think I'd be lying to say that no, I've never done that. I do have times in my mind thinking, no, not that this is. But I do think being sick and having cancer allowed me to realize that you don't know what people have going on in their life. And so they come in to see us for this one particular thing. And maybe it's because they have a small splinter in their finger or a trigger finger or something that is painful, but it's not
Hold on. Trigger
debilitating.
fingers do hurt. Just
But what
keep
I'm
going.
saying is it's not debilitating. It's not, um, it does hurt. But what I'm saying is that there's different levels of pain, right?
Yeah. Yeah.
Let's say declare veins. I've had declare veins. It's not that bad. I've lived with it, but
Okay.
it can be sore tennis elbow. That's another one.
Uh-huh.
You know, people
Yeah.
complain of pain and it can be very painful. I've had it myself, but you don't know what else is going on in their life. You don't know the big picture. You don't know if at home everything's gone awry or they lost their job and all these other stresses, and that this is kind of the straw that broke the camel's back, and that they are overreacting because they need something to be fixed. They need something to go right for them. And I've learned to kind of step back and think, okay, there could be other stuff going on. I need to address what they feel their pain level is. And if it's really as bad as they say it is, let's try to take care of it and manage it. Um, and I try not to judge because I've been through a lot of different medical things, lots of different surgeries. Um, because I know that my perception of pain is different than somebody else's. And I also know that everybody has a cross to bear. And so my cross might be heavier that I might think it's heavier, but it may not be. There could be other things loading them down. So to answer your question, no, I don't always do that. Every once in a while in my mind, it pops up, but I try to push it out and just remind myself that my job is to help them feel better. And if sometimes those really dramatic patients have a dramatic recovery too. So that's always nice as well when they come in, they're like, you cured me. You're a miracle worker. And I'm thinking, well, I just gave you a cortisone shot, but it works, you know?
Yeah. Yeah.
Um, and
So,
sometimes you cure them too. I mean, patients do love that you cure them. Like, oh, Dr. House is so great. So
yeah.
yeah, I don't want to take all the credit.
Yeah. So with being a patient and being a provider, there's a lot of stuff about how you discuss something with patients, and in an office visit, it's stressful. They may be in pain. They might have just been told they have cancer or something like that. They only
Mm-hmm.
retain a certain amount of what you tell them. Do you have any insight on that from the patient point of view, where you went to these doctors and you got so much information at once that it was hard to comprehend it all? And you're even coming from a medical background. So do you have any special insight into non-medical background? You're sitting down with the doctor and they're trying to explain to you something that's really complex.
So I try to tell my patients, especially if I know that I need to refer them to someone to have surgery, or if they're having a big procedure, you know, we're going to do a total knee. I always encourage them to bring someone else with them, because even for me, I felt like I really tried to understand everything about it. But sometimes your mind drifts, the emotions get the best of you, and you may miss something. And so I try to encourage patients, especially with something really complicated, to have someone else there with them to maybe catch it or ask the questions that they didn't ask, or that they mentioned they wanted to ask and they completely forgot. I mean, I don't know how many times I've had a husband or wife say, remember you wanted to ask? Oh, yeah. I forgot about that. So I think having a medical partner is important. I mean, all the kids we see, they always have an adult with them. And lots of times the kids remember more than the adults do from the appointments. And you see a lot of elderly couples come in together, but it's that middle age, you know, where they come in by themselves. And especially if it's something that needs something surgical, it can be difficult. And those tend to be the ones that call us back and say, I didn't quite get this. Or they have somebody else call and say, can you answer these questions? Because I didn't quite get what they were telling me. Do you agree with that? Do you think they comprehend better when they have someone with them, or?
I do think they comprehend better when they have someone with them. I also think that's why sometimes it's nice, especially if you're doing a big procedure, to meet them more than once.
Hmm.
So it's helpful to be the person who maybe evaluated them, maybe ordered the test, maybe tried some conservative care. You always worry a little bit about it when they come in for the first time, they're all teed up for surgery, that it's a lot going on, especially if they're in a lot of pain that day.
Hmm.
Sometimes it's something
Or
emergent
on pain
where,
medication. So they
yeah,
might be
we're
on
on
pain
pain medicine.
medication,
Yeah.
which
Yeah.
happens to change the thought process.
And sometimes it's something that's relatively emergent, like it's a broken wrist, it's bad, it has to be fixed.
Yeah.
You just got to get it done. But other things that are more elective, but are a big deal, that are going to require a lot of therapy, especially when the success of the procedure depends on the therapy. You really want to make sure they hear you, especially that part where you're kind of giving them the pep talk to get ready to go and work hard in their therapy. Um, so the other thing I was thinking about, and this is kind of related to cancer, and I've only been thinking about this recently. You mentioned you have
Oh
tennis
gosh.
elbow. I have tennis elbow right now also. So this is on my left arm. I had it on my right arm before.
Are you
And
trying to one up me?
no, but tennis elbow is the perfect example of this, is that, tennis elbow, it's pretty clear that almost everybody gets better from tennis elbow with very minimal treatment. We do cortisone shots sometimes. You virtually never really need an MRI because whether it's tendonitis or a tear, it's treated the
You treat it the
same.
same. Hmm.
So you don't really need that, but it does hurt and it feels deep. So I get it when you're like, oh, it's just tendonitis or it's just a partial tear of the tendon. I totally understand why someone would be like, this can't just be the tendon. So where
Well,
I'm
I
getting
know.
the cancer thing is that it feels deep. So you wonder how often people come in with any joint, but in the back of their mind, they do worry it's like a bone cancer or something like that. And how often they actually push for the MRI. Maybe they're not even communicating with us, but they're like, I have a history of breast cancer. My knee's hurting.
Hmm.
He says the x-ray looks good, but I really want that MRI, even though he's saying, hey, let's try some conservative care.
Right.
And in general, you would say, well, what's the harm of getting the MRI to decrease a patient's anxiety? And I mean, if you're up at night losing sleep over your knee pain, and I'm telling you that it's arthritis and we don't need an MRI, but in the back of your mind, you're terrified of cancer, I have no problem ordering that MRI to help your stress level or anything like that. My concern is that as people age, no one has a normal MRI. Like there's always
Hmm.
something on MRI. And just like there's a placebo effect, there's a nocebo effect. So if you find out you got a tear of something, even though we might be like, that's totally normal for somebody your age, um, are we ordering MRIs, or even are people kind of wanting to be opened up because they're so worried they could have cancer? Has that ever crossed? That's a huge, long story about, has that ever crossed your mind?
Oh, of course. I mean, even me with my orthopedic knowledge, when my tennis elbow was so bad, I remember thinking to myself, if I didn't know what this was and I knew all the tests and I knew exactly, I would think I should scan my arm because I wonder if my breast cancer spread to my elbow because it does. It does feel deep. Same thing with De Quervain veins. You know, I had a cyst from the De Quervain veins, and I have patients come in all the time that say, how do I know this isn't cancerous? Well, we see these cysts all the time. You can tell that it's very superficial and it's not cancerous, but in their minds, they think, well, it could be. My cousin Johnny had a cyst and it was cancerous. And so a lot of times we are just treating them, their anxieties more than anything else, because they could be that one black swan, or that zebra, as we use in medicine, like that it is something. So I try not to over order. I want to educate the patients first. And if I've educated them and explained to them, this is probably what it is, this is what I'm seeing. And if they still kind of push it, I don't fight it as much because I've been there. I know what you sometimes worry and think about. And if their mind is there and they have that anxiety, they're going to make themselves feel terrible anyway because they're going to be so stressed. All the inflammation is going to be elevated. Um, but I do worry, like you said, about ordering some stuff that you ended up getting a MRI of the knee, you see a meniscal tear, we scope it, and then they're not necessarily better because it really wasn't a problem to begin with. Um,
Yeah.
it could have just been some just general, just some arthritis that was flared up that they worried and that they over exaggerated their symptoms to have the surgery. Back to
Yeah.
the over exaggerators.
Well, I totally get it. I mean, if you had a history of cancer, like everybody gets back pain, and everybody's middle age gets back pain at some point in their life. If you had a relative who had metastatic breast cancer and it went to
Mm-hmm.
their spine, your first thought is going to be, oh, maybe I have cancer in my spine.
Mm-hmm.
And most back pain, most of us have it at some point. It gets better with physical therapy. But nobody has a normal MRI. Like you're never going to see a normal MRI in somebody above 40. It's going to show degenerative discs. It's going to show arthritis. It might show a little bit of stenosis, which is narrowing of the nerves. And you worry about being like, well, therapy's not going to fix that. So going to too much treatment, it's an issue. You got to make sure, you got to make sure you're not over treating and you're kind of taking your protocols and step by step. And if most people get better with therapy, you need to do therapy. If most things get better in 6 months, you need to give it 6 months. You
Mm-hmm.
can't alter your treatment plan. And I guess the best way to say it is sometimes like you're more likely to get hit, to die in a car accident on the way to the radiology place than you are for your tennis elbow to be breast cancer mets to the outside of your elbow.
Yeah. And I agree with you with that. I think that part of the problem is that, you know, these patients, and I just kind of quickly lost my thought because Landon was screaming for me.
Yeah.
Um, oh gosh, I love my kids.
Yeah.
Um,
I could not hear him at all. So we're good.
oh, I can hear him. He's like
Okay.
buzzing. I'm like, give me a second. Um, uh, yeah, we were talking about radiology. Anyway, I digress. I don't know where I was going to go with that.
Well, there's a term. I don't know where I came across it, but it's
Oh,
vomit, which
therapeutic.
is, say it again.
I was going to say that a lot of times that the MRIs are the treatment in of itself. So you get the MRI. How many times have I ordered an MRI? Someone comes in terrible pain in their knee. I get the MRI and then I say, well, follow up with Dr. House. They follow up with you and their MRI has a small tear, but they're like, oh, my knee doesn't hurt at all. And they're like, well,
Yeah.
why did you have me see them?
Yeah.
Talk about surgery because a lot of times they just want to know. They just want to know what's going on.
Yeah.
And that fear of the unknown causes that anxiety. And so there's a lot of times that we are arguing, I would say arguing, but disagreeing with the patient whether they need the MRI or not. And the majority of those cases, when there's come back normal, their pain goes away too. It's just that they wanted to know.
The term I was going to say as I saw was vomit, victim of medical imaging technology.
Oh.
And basically ordering MRIs or different scans, x-rays, can be great when it has the role of a placebo effect. So the person who they know their MRI is not going to be normal, but you're like, hey, there's just some normal wear and tear. This is normal with age. And they're like, cool, I'm good to go. You worry
Mm-hmm.
about the patient who it becomes a nocebo effect where it's negative, where they can't stop focusing on, say, their partial tear that really we
Mm-hmm.
all have,
Right.
or they become their diagnosis, like where everybody gets degenerative disc disease. It's just gravity at the lower part of our back. Everybody's going to get that, but you don't want to become I am degenerative disc disease. Like
Right.
there are people who end up needing surgery, but the vast majority of us can get better with just physical therapy and being active. So it's like you never want to, you really want to make sure you don't become the identity of your disease, whether it's orthopedic or you're not diabetes. You have diabetes. You're not you, but whoever it is, you don't want to become your
That's
diagnosis.
one thing I don't have. I have a lot of
Yeah.
other things that
Yeah.
have that. So,
Yeah.
um, yeah, I agree with you. I think a lot of patients do tend to focus on that one thing. Or, there's times we tell people, oh, you have a little bit of arthritis behind your patella, behind your kneecap. And they say, well, if I have a little bit, you might as well just replace my knee because it's going to get bad anyway. And you have to explain to them, well, it's only a small amount. Yeah, but it's only going to get worse. So why not fix it now? And so some people are just apt to say, well, I'd rather just have it done. And we have to explain to them. And I think that's something that as healthcare providers, it's important for patients to become as educated they can about what the true protocol of treatment is. But it's difficult when we're not all doing that same protocol. So if a patient comes to you and wants them to do a knee scope on a normal knee, and you say, well, there's nothing to do, they'll find a surgeon that will scope their knee. It's just kind of going around without having to do the therapy. So it happens because not everybody's following that same thing. People have a lower threshold to say, well, you know what, I'll just do it. Without trying to push the patients through the correct treatment plan of therapy or medicines or what have you.
So
And I think,
did your experience as a patient change any of your, change any of the way you treat patients making these decisions, the way you explain it, anything like that?
I
Because,
try to.
I mean, you're not going in for total body MRIs every 3 months type of thing.
No, and not at all. And I try to tell patients, I mean, you talk about the back pain. I was having some terrible back pain after treatment, and they thought some of it was post radiation stuff. But given, you know, that it was stage 3 and it was a very aggressive cancer, me having back pain was very concerning to the doctors. Well, as a result of me having these MRIs, which my back was fine, besides some mild disc, bulges that you would expect in a 40-year-old, they found pulmonary fibrosis. And so for me, I breathe fine. Everybody's like, you're fine. I feel fine. It doesn't bother me. I don't even think about it. But I feel like someone else could be so concerned about that, not having the knowledge that it's a normal side effect of having radiation, and people can have it and be perfectly fine like I am. So I think just staying active and doing my normal stuff and not thinking about those things has helped me. But I try to tell patients, I have a lot of stuff that comes up. If you were to scan my back, scan my knee, I'm sure that you would find these things, but it's a matter of being able to tolerate those symptoms and modify what you're doing. So for me, I found that actually running makes my back hurt worse. And so I just modify. I do other things. I walk, even though I never actually participated in the walking challenge. I did walk. But I
There
do
was a
yoga.
sprinting challenge before the walking challenge.
Yeah, and I wasn't doing that.
Okay.
I wasn't doing that because I wasn't doing
I
that.
might do my next challenge, about a strength challenge. And I didn't mention were you the weightlifting champion of North County, like 19 or 2000,
Unofficially.
This is just.
But I mean, I did have the weightlifting records of
So what
all
do you
4
think about
lifts.
the strength training challenge?
I think it's possible, but they have to be smart. I worry that people might get a hernia by trying to do overthink. I think almost you should focus on like a push-up, sit-up challenge,
I was
something
thinking about
that
maybe
is,
doing planks and push-ups or something like
yeah,
that to keep people active.
challenge people to do that every single day to where they do, 100 or whatever, something.
So you mentioned what you did for stress during your treatment. So now how many years past it are you?
9, this summer will be 10 years since my diagnosis, which is crazy.
Okay. So is there anything like lifelong that you do for stress reduction? First of all, so you can just be functional as, being a busy mom, having a career, but also with any, decreasing stress does help decrease cancer. Is there anything you specifically do?
I still try to pray. I try in the car to say a rosary. I feel like that kind of causes me to focus in on something and take that time when I am in the car by myself, which isn't often, but I try to take that time to focus on those things. I still do some yoga, walking, with my husband. I feel like we were on the boat a lot this summer, and I'm being just outside. And sometimes just being there and just kind of looking around without talking to anyone, trying to empty my thoughts has made a difference with some of my stress levels. But as you know, it's hard in the summer or really anywhere to be completely by yourself. For me, with kids and the community and work, I don't have a lot of time where it's just me and my own thoughts. So it's important to be able to take those times to be able, when I have those small amount of times, to really use them to my advantage. Because you do a lot of stuff like that. You go for a lot of walks.
Yeah.
I know you listen to a lot of podcasts, but I'm sure that's part of your stress relief, right?
Yeah. Yeah. Do you have any issues? You talked about your kids. Do you have any issues, harassing your husband about health, nutrition, any of that stuff because you've been through cancer or because you've been in orthopedics, or are you like,
All
do
the
whatever you
time.
want?
All the time. All the
Uh-huh.
time. And my husband and my kids, they don't listen to me from some of that stuff. I mean, I tell them certain things. I mean, I think Michael came in, had like wrist tendonitis. He didn't break his wrist. He didn't believe me. I had to get you to tell him for him to believe someone.
Yeah.
My father-in-law is another example. I said he had shingles, and I called you and said, my father-in-law has shingles. Can you look at him? And he's like, man, that Dr. House knew right away that I had shingles. No, I knew you had shingles and you didn't listen to me. So he
So,
tells you you have
so
shingles.
my kids go to my wife for everything. And the rule is don't call dad unless it's been hurting for like two days or something. And like my oldest Ryan, one time he called and he's like, I hurt my back working out today. And you can just hear Roddy going, today, what are you doing? You know, rub some dirt on it and call him in 48 hours if you're not better. He was shocked. He didn't know that you could even ask dad.
Well,
So,
it's funny because we do have that guideline with our families. We're like, yeah, it's fine. Just let him walk it off. Give it a couple days. But we see so many people in the office that we treat them completely differently.
yeah.
What's kind of funny.
Well, and it's weird because you worry though about the person coming in 3 weeks later when it really needed to be treated within that 2 week window.
Yeah,
But at least we can tell with our own kids to be like, okay, you're going to be fine. It could be something,
right.
but it's going to be fine at first. So some of the people I'm interviewing are people who have kind of recreated themselves in middle age.
Mm-hmm.
But it's mostly kind of like more empty nester type of thing. So you are right in the thick of things of
Mm-hmm.
kids, school, work, life. So even though you're not what you are middle age, we're past middle age, but, are you making any plans, any thoughts for 10 years from now, empty nester, how you're going to fill your time? Like, does the planning start now kind of thing?
I
Or
think
can
so.
you not even imagine that?
I mean, it is really hard to imagine because I really am in the thick of things. I'm a unpaid Uber
Wow.
driver, cook, laundry person. I mean, it's, you do all these things that are not like take up my time that I think, man, where did my day go? But I do think one thing my husband and I like to do is we like to be outside. We'd like to play tennis and like to play pickleball and doing things like that together. Um, because I'm someone that, although I was saying before, I do like those moments alone. I'm a people person. I like to do things with other people. When I work out, I don't necessarily like to work out alone. I like to do it with other people. I like the social aspect of it. So I think I definitely see my going forward of increasing our physical activity, but mostly doing it together, or with other people. You know, I have a lot of friends, locally that we do a lot of pickleball together. We play a lot of tennis. And I'm not good at either, but I enjoy it. And it's like it's more a social way for me to work out without feeling like I'm working out. So,
And then do you do anything just to make sure that you'll be able to do those things when you're in your 50s or 60s?
oh yeah, I mean, another part of my diagnosis that kind of put a damper on my whole body is that because my cancer was hormone positive, they had to take out my ovaries. So it put me into menopause at 35. So for me, keeping weight off, keeping my energy up high, and not having my body kind of ache because of that lack of estrogen and kind of depleting that down has been difficult for me. So I try to do all those things and stay as active as I can, stretch as much as I can. And I really try to make an effort of thinking about what I'm putting in my body. And it's tough because I want to be able to be here for as long as I can in my life and be as active as I can. But I'm even in a bigger, more difficult situation than most people my age because I'm in menopause. Most people don't hit menopause until their late 40s, early 50s. And I've already been there for 10 years. So, yeah, I think I have to be a little extra conscious of my nutrition and my wellness, which I think is great that you're doing this now too, because we've been talking about wellness and nutrition for years amongst 50,000 other topics and things that we talk about. So it's good that you're actually putting it out
We
there
should have
so people
taped
should hear.
literally, we should have just taped all those conversations and they could
Uh,
each be a podcast. So
no, some of
no,
those, no. No, I think
So last thing, because I know
our sense of
Landon,
humor, most people would not enjoy.
yeah.
Most of our sense of humor stuff.
So last thing, because I know Landon needs you, but you kind of made me think about just with doing pickleball, doing tennis, those kind of things. There is risk to being physically active. I am
Hmm.
always at the side where there's more risk to being inactive. So if you
Hmm.
were not doing anything, eating bonbons and Fritos and gaining 50 pounds and not
Yeah.
doing stuff, that would be far riskier. But how do you assess risk as far as you could get hurt playing pickleball or tennis, but also things like skiing or like your kid's wakeboard? Would you ever get on the wakeboard and give it a try? Like, how do you assess those types of risks?
So I think some of it relates to my neck, right? So I will not get on a wakeboard in fear that I will compromise my neck. My neck's been in a good position, knock on wood. I haven't had any issues with it, but I do push myself to where I feel sore, but I also remind myself that I'm also in my 40s. I've had a lot of medical stuff. I'm not going to be the champion. I'm not going to win everything. So my competitiveness has decreased significantly. And I think that that's allowed me to,
Really?
it, compared to what it used to be, it was terrible.
Okay, so when
Terrible.
you go to a wedding, you're watching the people dance. I think we met,
Oh,
we didn't mention your dance history, but when you watch people dance, you're not judging them and being who's the best, like who's the
I don't
best
need to know who's the
here.
best. I'm the best. I know that. That doesn't matter. So
Okay.
that's a silly question.
Okay.
Next question. No,
But you're not going to do the spin on your head, break dancing
no,
because
I'm
of
not
your
going to
your neck.
do that stuff. Right. So I've
Okay.
modified. I mean, I really
Okay.
have modified. Um, I think I have. I don't know. I don't usually watch myself dance at these weddings,
Okay.
but I do have a good time.
Okay.
Um, but I think from a tennis aspect, or even like you said, wakeboarding was an example, I try to just make smart choices and I try to listen to my body. I think a lot of the injuries that you kind of referred to of people happening on the court at my age, a lot of times it happens because they haven't been doing something for a while and then they get out and try to do something back to the level that they were before. And that's when some of these injuries happen. And I also don't think people stretch as much. We see so much tennis leg and Achilles injuries in tennis players. Because I don't think people are stretching because they don't think they need to because they didn't have to when they were 20, but they're 40
Yeah.
now or 50 now and they need to do that. So they need to warm up appropriately. So I
There's
try
definitely a
to practice what
level
I
of kind of
teach.
like you hit 25, and if you're going to be doing all the sports, whether it's tennis, a a middle-aged soccer league, pickleball, whatever it is, you kind
Mm-hmm.
of got to put in the work before to kind of bulletproof your body a little bit. It's never going to be 100%. You're always going to have some
Mm-hmm.
injuries, but like Tom Brady can't just show up and throw footballs. His arm would fall off. So it's same
Right.
thing. You can't just show up and play tennis without doing some fitness routine.
Mm-hmm.
You might get away with it in your 30s. You might even get away with it in your already 40s. But people who are not playing tennis in their 50s without doing something or pickleball.
Right. Right. Or they injure themselves, which we see
Yeah,
a lot of. And that's not to say people that are really good tennis or pickle players that play all the time don't injure themselves also.
yeah,
But I think that the cases that we see of trauma happen because of people not either warming up appropriately or preparing their body or listening to their body. They say, oh, I can still do it, so I can push through it. Well, sometimes your body's telling you not to do something, so you just need to listen to it. I try to do that as best I
yeah.
can. Or at least I use it as an excuse for why I lost the match, so I can do that too.
Okay, awesome.
Whatever works.
Well, you are doing a great job. So we're gonna finish on that so you can do whatever you have to do for the rest of the night. Do you have any
Yeah, I got it.
final thoughts?
I do not have any final thoughts, but thanks for having me. I will see you in the office tomorrow, and we'll have probably another conversation that we'll need to record about something else. So it'll be great.
All
So,
right, cool. All right, see ya.
all right. See ya. Have a good night.
All right, you too. Bye.
Gonna hang up.